Hi, my name is Alex Borge.
Hi, my name's Lydia and I've been working at paired learning at Birmingham Childrens Hospital.
My name's John and I'm a doctor.
And I'm Harry, I'm a manager.
Hello, my name is Helen. I'm a medical student at the University of Birmingham.
I want to tell you about this wonderful initiative called Paired Learning. Paired Learning seeks to bring together people from different professions in order that they work together and understand a little bit more about each other's roles. This could be over a cup of coffee or getting involved in an improvement project together, but the aim is always about trying to make it such that we understand a little bit more about what other people that work in the health service are able to bring.
This year for NHS Change Day, we would really like to encourage more people to be doing paired learning, whether that's between doctors in training and managers or anyone else in the NHS or outside of the NHS. We feel that there's so much to learn from getting to know each other's roles and meeting new people and getting to know the challenges and the barriers that we all face, and that by getting to know each other better and working together better, we can make sure that these don't stand in the way of improving things for patients.
So in our trust, we've tended to focus on bringing together managers and doctors. However, that isn't the limits to paired learning. You could have allied health professionals working with managers, nurses working with doctors. The opportunities are endless.
The other thing that some people are doing for NHS Change Day is setting up a programme of paired learning in their organisations, whereby we're connecting people who don't usually work together to make new partnerships across the organisation so that change can happen more effectively and people can be working better together for patients.
So myself and John have been working at the Trust for the last 6 months, and we've been working as a pair on improvement projects together as part of the paired learning programme.
Before I met Lydia, who is a manager, I didn't know that much about managers in the NHS. I didn't really know what their role was or how they impacted on patient care, and didn't really think that they were that important to the day-to-day running of a hospital.
So what have you enjoyed about paired learning, John?
So it's good. It's an initiative I wish had happened earlier in my career, because it's been a really good chance to get to know a manager like yourself and develop a working relationship with you. And part of the project's been working on is to write a business case, which I'm in the process of doing at the moment. I think the main thing is really to break down the barriers, work more together to improve patient care, and I really think that paired learning can make that happen.
So as a medical student, part of my job when I'm older will be to work with and among managers and other clinicians in order to treat patients in my day-to-day job. So now that I know more about a manager's role and more about what they do in the day-to-day, I can feed that into my work.
So one of the other projects that myself and John have been working on is standardising all the ward folders at the Trust. So it seems like quite a trivial thing, and it doesn't, it can save 30 seconds for one person or a doctor on the ward, but that timed by 2,000 staff at the Trust is a lot of time that could be saved. So again, another initiative to come out of paired learning.
The care of the patients couldn't happen unless the managers did their job too. So really, the managers and the clinicians are just working towards the same goal. We're just trying to improve the care for patients, and if the clinicians want better services so that the patient care is better, and the managers want better outcomes to show that patient care is better, actually we're just working towards the same goal.
As a surgical trainee, I had some preconceptions about hospital managers that they were basically focused more on targets, be that financial or waiting lists, and I hadn't really appreciated how much they care about patient safety and improving patient care. And one of the things that has really been challenged for me is that preconception during working with Harry and with other members of the paired learning group, that we are all working together for the same thing, which is improve patient care and provide the best quality outcomes for those patients. So for me personally, I think this is something I'll take into my consultant career, hopefully having a much greater understanding of what managers can offer and how we can work together best to improve patient care in the future.
As part of paired learning is shadowing each other, so spending a day in someone else's shoes and seeing what their role is like, and then also sharing your experiences, so talking about this face-to-face on Twitter, on blogs, and therefore encouraging others to do more of this kind of learning by experience rather than learning by being taught, which we found is really effective to see what each other's values are.
One of the benefits of getting involved with paired learning at an early stage in my career has been that I've been able to work with the managers and also learn more about their work so that I can incorporate it into my own day-to-day work as a doctor, as a future doctor, early on. So because of this, I would really encourage all other medical students to try and get involved or communicate with a manager in order to learn just a little bit more about what their role is in the day-to-day and how they go about doing their job, and actually how important their role is in the wider hospital setting.
So I suppose my perceptions have changed. I think that especially with junior doctors, there's a wealth of untapped knowledge that could be utilised and has been utilised as part of this programme, pairing doctors and managers together to sort of use the combined knowledge of expertise to improve patient care at the end of the day, because that's what we're all here for.